This visit, it's a continuation of some of the meetings that have taken place in strengthening the partnerships between, that I could tell you now is 3 countries, United Kingdom, South Africa and Cuba. It's largely focusing on what are the support measures that can be put in place in strengthening the Cuban model that we actually have in South Africa. Now, this meeting therefore was looking into those aspects, and I think it has actually made significant milestones towards realization or actually advancing, strengthening the systems and strengthening the model that our students who go to Cuba, go to train, come back with. We must admit that it has not helped us in a way that it was envisaged. Of course, last year we celebrated 500 doctors who have returned from Cuba, but these doctors are scattered all over the country, and you do not therefore feel the impact and see their contribution in this regard. I think we need to make a concerted effort, because not only do they come back as doctors where you can count numbers and say now we have got 500, but I think because of their orientation that is focusing largely on primary health care, we have not as a country tapped on that part of their skill, and therefore we are still found wanting. And yet our national health insurance is talking about universal health coverage, whose primary focus is on primary health care. I think right now the meeting that was taking place here was reminding us that we need to be very strong on primary health care, and therefore the students who come from Cuba will be the pioneers and lead. Because to some extent this is led by nurses in our country, and therefore any program led by nurses who are not necessarily usually the leader of a team is not usually successful. So this primary health care focus is going to assist us in a great way. We are humbled by this. It talks to exactly what is happening, because we now learn today in this meeting that there are certain students who come from US who also come in and work and stay in Cuba for just 1 year. But they come with a very valuable experience, and their experience is therefore showing that there is merit in sending students to Cuba. And this is what United Kingdom is saying, and they're saying they benefit greatly from that, and they could actually impact positively. So the students who stay in Cuba for 1 year, and ours who go in there and stay for 5 years, they are now saying chances of us learning more from them are higher than if we were to learn from this 1 year. So we are very humbled by what UK is doing, getting students who go to Cuba to go and learn 1 year, comparing with us who we send for 5 years. If they think there's something that they can learn from the Cuba-South Africa partnership and they think it can add value, we're humbled by that, and we're really looking forward to strengthening that partnership. We were asked to make presentations on the health systems and the health challenges of South Africa, which we did, where we actually started by showcasing that we do face a quadruple burden of disease in our country. Of course, that was actually long mentioned by Lancet Journal in 2009, and therefore our programs are likely to deal with the issues of the quadruple burden of disease. Of course, we did touch on the processes and the programs that was initiated to send students to Cuba, and to say as a province of KwaZulu-Natal, we currently have over 700 students who are in Cuba training, and 262 of those are coming back next year, July, and therefore we need to be preparing their processes of getting them back. We are aware of certain deficiencies and weaknesses in our systems in receiving these students back. We need to work very hard on that and strengthen those pillars. That's what was our main focus of the presentation. We also raised the issue of Angola already sending students to Cuba, but also starting their own training in Angola to actually keep to the model that is being done in Cuba, but also taking that model and do it in the country. So that is our main focus of our presentation. That's what we were asked to make a presentation on.
In terms of going forward, I mean, do we keep the two separate systems? Do we try to merge and create a triangular peg for a triangular hole? Is this an opportunity for a revolution of sorts, a softer revolution in terms of medical practice in South Africa, to transform it, to clearly realise the very real need there to have a primary care system?
Si nabantu mhlawumbe abalindeleke ukuthi mhlawumbe la ko 55 million people eningizimu Afrika yonke. Uma ubheka ke izibalo zezinyuvesi ezikhona, ama-university akhona mhlawumbe alinganisela ukuthi ayisishiyagalombili 8 kuphela for i-population yabantu abawu 55 million. Kanti ke uma ubhekwa indlela ama-universities akhipha ngayo, akhiqiza ngayo abafundi ke abawodokotela, kubonakala lana ukuthi mhlawumbe i-university iyodwa ingakhipha odokotela abangevile mhlawumbe abafika ku-200 uma nje ngikalekisa. So kuma ubheka ukuthi South Africa yonke ngonyaka ikhipha abantu abangevile ku-1500, uzobona ukuthi uma kubuya ke labantu abafunde eCuba babuye eSouth Africa, lezi zibalo zizophindwa kabili. So kuma uthatha ukubheka ke izingqalasizinda eziyi-infrastructure, ubheka futhi nenani labantu okumele babafundise, uzobona lana ukuthi ziningi izingqinamba ngempela ezisazoba khona ekuthenini labo bantu bakwazi ukuthi bangene ngendlela, bafunde futhi ngendlela elindelekile. Kodwa ke ngiyathemba ukuthi lana ngokukhuluma njengoba sesizwile kukhulunywa kanye nabanye abaphathi bamanyuvesi akhona ase-South Africa, sibonile la ukuthi zikhona izinhlelo ngempela ezikhona ezibekwe umnyango besebenzisana kanye nawo phela ama-university ukuze bezokwazi ukuthi balungiselele ke wonke ke abafundi ababuyayo beza eSouth Africa bezoqedela izifundo zabo zobudokotela.
We would want to sit back and look at the impact of those students coming back as doctors in the next 3 or 4 or 5 years. If we think that there's still a deficiency, we will then continue to send more students to Cuba, or we will then be advocating for this Cuban model being started in our country going forward. So for now, we will hold on and focus on just one aspect: preparation for the students returning back and making sure we do everything humanly possible to get them to be all over the country, all over the province, and work there in all those identified sites.